Public health, its ultimate goal is to improve health outcomes of all people across populations.
Public health professionals bring an intersected approach.
It combines concepts and principles from a lot of other disciplines.
And they can look at problems in a way that is different.
We focus more also on prevention rather than trying to treat certain diseases or illnesses that occur in people.
In its simplest form, the mission of the University of Illinois at Chicago School of Public Health is to improve the health of the public. We do that in various ways. One is by teaching the next generation of practicing professionals. A second is by doing research to advance knowledge in the field. And a third is to practice in service with our partners in the community to translate our knowledge into real-world impact. The main research priorities for the school are global health, urban health, and in particular health equities in relation to those other two.
Public health is global health.
It's basically looking at the entire world as one single community and thinking about how to protect and improve the health of this entire community that is the world.
You can't escape the fact that things are happening around the world.
Diseases know no boundaries. They don't remain in one country.
So it's our responsibility, I think, as public health professionals to address not only our issues in terms of health here, but the global issues.
We don't just see it as something that happens over there in another country, but it's also right here domestically in our city and in our state.
Urban health is actually about looking at the urban population and trying to find things in the community that will either enhance the health of people living in this community or endanger it.
And urban areas present certain different and perhaps more difficult issues to deal with in terms of health than other areas.
It's our obvious focus because of our placement here in the city of Chicago, our relationship with community-based organizations and other institutions in Chicago, and really our mission to improve the health of all people, starting with those in our backyard.
Health equity is an approach to solving health disparities across populations and trying to improve ultimately health outcomes and accessibility of healthcare and quality.
To me, health equity is access in a way that doesn't promote disparities.
One thing that's critical is attracting students from the disadvantaged communities that suffer most from health inequities.
My community can be considered a slum because it's a lot of poverty there. For me, the inspiration is to work hard, learn, and go back and be able to apply some of the knowledge that I've acquired and help improve certain situations there.
When I think about UIC, I think about the great diversity.
It's a perfect setting to meet all people from different countries, different cultures, with different experiences, perspectives.
It allows people really to bring their strengths to our learning and also to our engaged practice.
We really create a sense of community here. It's really important because it's also what our public health is about, creating community in solving problems and learning from each other.
I think the future of higher education in general, including public health education, is to be more engaged in solving real-world issues.
We are kind of reconceiving what is health, and we're engaging in partnership with people who are most impacted by the social phenomena that we're interested in, and I think that can only really advance our inquiry and advance our opportunity for action.
Higher education has to adapt to a changing world, and I think we are a model for that change for all of higher education, not just public health education. That's exciting.